Inside the pregnant uterus, the fetus develops within a protective environment. Attached to the uterine wall is a temporary organ known as the placenta. Through the umbilical cord, the placenta connects mother and baby, forming a vital support system for growth and survival. The placenta is a highly specialized organ that attaches to the inner lining of the uterus. Its surface contains an extensive network of branching blood vessels. These vessels allow nutrients and oxygen to pass from mother to fetus. At a microscopic level, placental villi extend outward into maternal blood spaces. Maternal blood flows around these villi, while fetal blood flows inside them. This close contact enables oxygen and nutrients to cross into fetal circulation, while waste products move in the opposite direction. In a healthy pregnancy, uterine arteries deliver oxygen-rich blood to the placenta. Fetal vessels within the umbilical cord return oxygenated blood to the baby. This continuous circulation sustains fetal growth throughout pregnancy. Beyond circulation, the placenta also acts as an endocrine organ. It releases hormones into the mother's bloodstream. These hormones maintain pregnancy, support uterine stability, and regulate maternal metabolism. In placenta previa, the placenta develops low in the uterus. It may partially or completely cover the cervix, the opening through which the baby must pass during delivery. Placenta previa can present in different forms. In marginal previa, the placenta reaches the edge of the cervix. In partial previa, it covers part of the opening. In complete previa, it fully blocks the cervix. The degree of coverage determines the level of risk. When the placenta blocks the cervical opening, it prevents the fetus from safely descending during labor. This obstruction increases the risk of bleeding and often requires surgical delivery. Normally, the placenta attaches to the superficial lining of the uterus. In placenta accreta, it attaches too deeply into the uterine wall, invading beyond the normal boundary. Placenta accreta spectrum includes 3 levels of severity. In accreta, the placenta is firmly attached. In increta, it invades into the muscular layer. In percreta, it penetrates completely through the uterine wall. Each level carries increasing delivery risk. If the placenta is deeply embedded, it may not detach after the baby is delivered. This can cause severe bleeding and requires urgent medical management. Placental insufficiency occurs when blood flow to the placenta is reduced. The villi may become less effective in exchanging oxygen and nutrients. As a result, fetal supply becomes limited. When oxygen delivery decreases, fetal growth may slow. This condition, known as intrauterine growth restriction, results in a smaller than expected fetus for gestational age. Placental abruption occurs when the placenta separates prematurely from the uterine wall. This separation disrupts oxygen delivery and may compromise both maternal and fetal health. As the placenta detaches, blood can collect behind it. This internal bleeding increases pressure inside the uterus and further reduces blood flow to the fetus. In vasa previa, fetal blood vessels run close to the cervix without the protection of placental tissue. If these vessels rupture, it can result in rapid fetal blood loss. In velamentous cord insertion, the umbilical cord attaches to the membranes rather than directly into the placenta. This leaves exposed vessels vulnerable to compression or injury. Some placentas develop in 2 or more lobes connected by blood vessels. While often benign, this variation increases the risk of retained tissue after delivery. Most placental abnormalities are detected through ultrasound imaging. Advanced Doppler techniques can assess blood flow, helping monitor fetal well-being. The placenta is a temporary organ, but its role is permanent in determining fetal health during pregnancy. When its position, attachment, structure, or function changes, risks can arise. Early diagnosis, careful monitoring, and appropriate management significantly improve outcomes for both mother and baby.